Enforcement of childhood vaccines. In any given moment, we have two options: either step forward into growth or step back into safety. Abraham Maslow. Immunization is a very touchy subject for a lot of parents. It borders on the lines of ethical rights, moral rights, and the rights to choose due to social and religious beliefs. But who does it ultimately affect? It affects the ones that don't have a voice. The children. They're the ones that catch the colds, get the infections, get ridiculed when they spread a preventable disease. The children are the ones that are kept out of school and miss work and kept back. I propose mandatory vaccines for public school children. This policy will affect all children going to public schools, as well as their parents, teachers, healthcare providers, and the communities. This health issue impacts the community tremendously. According to Gorney, 2017, because when our communities and our immune system is left defenseless, it becomes life-threatening, and our children are most vulnerable. We were losing 800,000 infants and kids under the age of 5 every year to bacteria that is now preventable or at least reduced by millions. This health issue needs to be addressed because parents are starting to rethink the necessity of these vaccines because these diseases are reduced tremendously, thinking they're related to other childhood diseases like autism. Truth is, according to Silverman and Wiley in 2017, the only way to keep the infectious diseases to a minimum is to make sure that the eradication measures are held in high regards and the efforts are followed closely. Vaccination guidelines must be followed to continue to protect everyone in the communities from preventable diseases on a global scale. Mandating that children get vaccinated will not only affect the children by keeping them healthy, but according to a report by Silverman and Wiley, 2017, if enough people are vaccinated, it will reduce the amount of transmissions of bacteria and prevent an outbreak of any type of disease, such as measles, mumps, the flu. There will be quite a few changes during this policy period. Enforcing this policy will lead to new community programs for low-income families. They may not be able to afford to take their children to the doctors or not have transportation to get there. Also, there may be programs like No Child is Left Behind in this year's flu epidemic, with surge in demand for vaccinations by Bosley 2018. There's also going to be a lot of upset parents feeling as though their rights are being trampled upon or taken away from them until they understand that it's not their rights that are being taken away or trampled upon. It's the children's rights that are being upheld, or a voice that they're being given. The right not to be ill. The right to attend school with other children. Not to be excluded or counted out. The right to live. Can you really put a price on a child's life? Can you put a price on being well? Well, I guess you can. everything has a price. Even life-saving substances such as vaccines. For example, to create a vaccine, it costs anywhere between 200 million to 500 million. And a cost per dose is anywhere from $40 to $250 per dose. And that's just per Walgreens price menu. This policy is quite risky. Enacting a policy like this could result in many children being taken out of public schools and being homeschooled or kept out of school due to a parent's refusal to comply. But on the other hand, there could be a dramatic drop in preventable childhood diseases, a rise in school age enrollments, and inclusion in programs such as the school-based flu program. We have to make a conscious decision to save our children and our communities. As a whole, we have to protect our children. There are going to be percentages of risk with everything that we do. But the benefits of vaccinating our children against these preventable diseases far outweigh the risks of not vaccinating them. Once again, we have a choice. In any given moment, we have two options. Either we can step forward into this growth or to step back into safety. I choose stepping forward. Abraham Maslow.